What's 5 minutes? The amount of time you spend in your average fast food drive-thru. How long it takes to post on Facebook, stretch after exercising, load the dishwasher, take a shower, and take out the trash. All ordinary, everyday activities. But there is one extraordinary thing you can do in just 5 minutes. As part of a well-child visit, you can examine and assess a child's teeth. All it takes is 5 minutes for a lifetime of good dental health. Did you know the most common chronic childhood disease is tooth decay? It's 5 times more common than asthma. Nearly 40% of North Carolina children entering kindergarten have experienced tooth decay, half of it untreated. That's why good dental health early is so important.
Thank you. I like eggs. Am I supposed to eat it now?
Yeah.
Kids with healthy smiles can speak and eat properly. They don't hurt from tooth and mouth pain. They feel good about themselves. And most important of all, they're safe from the deadly infections poor dental health can cause.
Good morning, Crystal. How are you doing?
That's why it's recommended that every child have a dental home by age 1.
You doing good? Can you give me 5? Good girl.
In the real world, less than 2% of 1-year-olds visit a dentist.
We finished the dental varnish and looking at his teeth.
But almost every infant and 1-year-old visits a pediatrician. You are the front line, the triage team, for children and their teeth. All it takes is just 5 minutes with the Priority Oral Health Risk and Referral tool. The tool is designed to help you assess risk and make referrals. It's a simple 2-step process. Ask parents a few questions about dental health in the home and do a visual check of the child's mouth. That's it. Only a small percentage of the children you see will actually have problems and need a referral to a dentist. Here's how it works. Section A of the Risk and Referral tool is a short list of yes/no questions you or your nurse ask the parent or guardian about behaviors that could affect the child's teeth.
Do you brush your child's teeth at least once a day using toothpaste with fluoride?
Does your child drink fluoridated water?
Does your child drink juice or sweetened drinks between meals, or eat sugary snacks?
Have you or anyone in your immediate family had dental problems?
Does your child sleep with a bottle filled with a drink other than water?
Is your child currently being seen by a dentist?
And what's the dentist's name?
Dr. Congleton.
Okay.
The point of these questions is to figure out if there are any risk factors, red flags, that would make you want to refer the child to a dentist. If 3 or more of the shaded boxes in Section A are checked, if you see 3 or more red flags, refer to a dentist. Section B of the Risk and Referral tool is a series of yes/no questions for you as you examine the child's mouth. All you need to assess a child's mouth are good light, 2x2 gauze sponges to dry the teeth, a disposable dental mirror, and the Risk and Referral tool. Position the child for the exam. You can do this 2 ways: by sitting knee to knee with the parent, with the child lying between you and the head in your lap for easy access, or you can assess the child on the exam table. Next, examine the child's mouth. Complete Section B based on what you see in the child's mouth.
Does the child have any special health care needs?
Does the child have cavities or cavitated lesions?
Does the child have visible plaque on the teeth?
Does the child have enamel defects?
Does the child have white spot non-cavitated lesions?
Does the child have any other mouth problems?
The point of these questions is to see if your examination of the child's teeth and mouth reveal a need for a referral to a dentist. If you check yes to one of these questions, refer.
getting in the back molars, really brushing the teeth well twice a day.
The last thing you do is discuss good dental health behaviors with the parent or guardian, as needed, and check the appropriate boxes for questions 13 and 14, which list which procedures you performed and if the child was referred to a dentist. Remember, in your discussion with the parent or guardian, the key points you want to cover are: at the appearance of the first tooth, parents should brush children's teeth twice daily with a tiny smear of fluoridated toothpaste on a child's toothbrush or a clean cloth. The best drink for kids between meals is fluoridated water from a sippy cup. Healthy snacks build healthy teeth and healthy kids. Remind parents to take care of their own teeth, and that it's important to start their kids' dental visits early, at age 1 if they can, and no later than age 3. The risk and referral questions, the mouth exam, and counseling tips can help you keep kids healthy and flying high. Section C of the form is completed by the dentist if you make a referral. That's it. Examine the child, complete the form, and make the referral if needed. Of course, in a perfect world, all kids would have a dental home by age 1 and no later than age 3. But they don't. So for now, it's up to you to connect the dots. Your priority is to help the right kids get to the dentist at the right time. The risk and referral tool makes it fast and easy. If you see cavities, refer. If you see white lesions, refer. If you see enamel defects, refer. If you see other mouth problems, refer. If you have 3 or more risk factors, refer. When in doubt, refer.
The PORRT form is very easy to use. The average child really doesn't go to a dentist until age 3 or 4 or 5, but yet we need to address the risk factors as early as possible. So it's perfect to fold it into our well exams, into our anticipatory guidance here in the clinic. It really only takes just a few minutes. Over the past 4 or 5 years that we've been doing this program, there's been a drastic reduction in the number of caries that we're seeing.
This risk and referral form is so important because it ties the pediatrician to the parent, to the child, to the pediatric dentist. We're all now one unit. We're a family working together for the benefit of that child. The partnership between pediatricians and the pediatric dentist is just wonderful because it makes us all communicate with each other. It's stimulating for the pediatricians, it's stimulating for us, and it's for the betterment of the child.
I'm so glad that they have added that step in examinations and stuff. It just keeps everybody on the same page. I'd like to take my kid to the doctor and have every part of her body checked out, not just everything excluding her teeth. That is a part of her body, and I want it checked.
I appreciate that they can come and see the doctor, and the doctor can look at them and have one trip, do it all.
It makes it easier to have the pediatrician check their teeth.
My kids have beautiful smiles.
What's 5 minutes? Everything when it comes to the health of a child. The Priority Oral Health Risk and Referral Tool is a good first step to connecting the dots. Just 5 minutes for a lifetime of good dental health.
There he goes.
Our job is to take care of the whole child. And part of taking care of the whole child is identifying their oral health risk factors, talking to the parents about keeping their teeth healthy, because without healthy teeth, it leads to other problems, whether it be cavities, infection risk, problems just with their smile, problems with their social interaction, their self-esteem. I think it's very important that we try and make sure that we maximize their ability to be healthy and strong.
Children's dental health, if you don't have good teeth, you can't eat, number one. If you can't eat, you're not going to grow, you're not going to develop, and you're not going to be happy. If you've got hurting teeth and you're trying to go to school or you're trying to learn, even to concentrate on watching TV, you can't do it. And that's why it's so important that we have children with healthy teeth and they're brushing and they know what oral hygiene is. That's the important thing for children.